My name is Dr. Everlyn Muthoka. I'm an obstetrician gynecologist and a Hifu specialist. So today is an exciting day because we're talking about one of the topics I'm very passionate about, and that is menopause. So allow me to take you through menopause and how that interacts with fibroids. So what do we mean when we talk about menopause? So menopause is the complete cessation of periods, and this is usually, the diagnosis is made in hindsight because a woman has to have gone through 12 months of no bleeding, no spotting for us to be able to talk about menopause. So what is the average age of menopause in Kenya, you may want to ask? So globally, we talk about any age between 45 years to 55 years. There are of course some outliers, that some women who may go into menopause before 45, or some women who may go into menopause after 55 years, but those are outliers and there are factors that can lead to that. So on average, this comes to about 50 to 51 years old. That's when most women, even in Kenya, will officially stop saying they're having their periods, or they will declare the last time they had their periods is more than 12 months ago. So last month, July, we were talking about fibroids. So how does menopause interact with fibroids? So we know that fibroids, uterine fibroids, are benign swellings that appear on the uterus, and they tend to be very common in women within the reproductive age group. So mainly we're talking about women in their 30s and in their 40s. However, it is possible for a woman who is postmenopausal, or a woman who stopped having her periods and has transitioned to menopause to still have fibroids. But the good news is, because with menopause comes the drastic drop in the estrogen levels, and we know that estrogen is one of the main factors that contributes to the growth of uterine fibroids. So when these levels drastically go down, the uterine fibroids automatically start shrinking. So one of the things that naturally happens with that transition into menopause is the uterine fibroids start shrinking. It is, however, very important to mention that the size of the uterine fibroids before menopause will affect how fast or how small they become during this transition into menopause. So sometimes the fibroids can still remain quite symptomatic if they were quite big during the premenopausal period, and also the location of the fibroids. So it doesn't automatically mean because as a woman you have transitioned into menopause that you might not require management for your uterine fibroids. It's very important to see your doctor, talk about the symptoms that you're experiencing, and your doctor will be able to advise whether you need treatment or not, despite having transitioned to menopause. So what is another thing that can happen during this period when a woman is menopausal? We do know that cancer is quite a big concern the older we get, and this is for both men and women. But because today we're talking about women, allow me to talk about some changes, or rather the risk of cancer, uterine cancer, in relation to uterine fibroids. There is something we refer to as sarcoma or leiomyosarcoma, and this refers to fibroids that are cancerous. So what are the things that as a woman you can look out for, and make sure you've gone to see your doctor if you have a history of fibroids? Remember, we say that fibroids should automatically shrink the minute you transition into menopause. So if you are menopausal and you start noticing that your fibroids are growing instead of shrinking during the menopause period, this is a red flag, and it is very important to go ahead and see your doctor. Secondly, if your bleeding had stopped for 12 months or above, and then suddenly you start noticing vaginal bleeding, again, this could be one of the factors that the fibroids have started growing, and it's important to have them checked out. So those are very important. Again, when it comes to the tests that we recommend, when we send a woman for an ultrasound, there are very important aspects we look at to see whether the fibroids we're looking at could be cancerous or not. as much as we're talking about a less than 1% risk, it's still a very important risk, especially for women who've transitioned to menopause. So we will look at an ultrasound, check whether there are any suspicious changes. Your doctor might require you to do an MRI for further follow-up or even more tests, because any fibroid growing at the menopausal age, that's a suspicious fibroid. It's not a guarantee it's cancerous, but it's very important to make sure it is not. Once we make a diagnosis of fibroids in the menopausal period and we notice that they are causing you either bleeding or they're still giving you pressure symptoms, then it's important for us as your doctors to offer you some options. So what are some of these options that we talk about? One of them is medicine. So there is one common injection that maybe you've had your doctor or you've seen some women talk about it, and it's one of the hormones produced by your brain, and it controls the rest of the reproductive system. So when we give you this injection as a treatment for the uterine fibroids, it causes the rest of the hormones, that is estrogen and progesterone, to stop being produced, and this assists with the fibroids shrinking. Now this is a good option for older women, especially those who are just about to transition to menopause, because remember, time will automatically cause a reduction of that hormone, the estrogen. So the medicine buys you a year or two as you wait for that period. So this is a good option for the older women. If the fibroids are still symptomatic and maybe this is not a good option for you, or we are talking about surgical or removal of the fibroids, at this age we can still talk about HIFU. I'm sure you've seen that on the media, high intensity focused ultrasound. This is still another option. However, remember what I had mentioned, it's important we make sure there are no suspicious changes that are suggestive of cancer. Thirdly, of course, we have the traditional surgical options. We're talking about open surgery for the very big fibroids. We're talking about laparoscopic surgery, or we can also talk about removal of the uterus. Now, I know for most women might feel a little bit attached to the uterus, and that is warranted, because not only is the uterus important for carrying babies or childbearing or even menstrual bleeding, it is also important as an anchor to the rest of the tissues that surround the pelvic area. It allows other tissues to anchor to it, and it acts as a main pillar in terms of support to surrounding structures. So it still does play an important role during this period. So if there is nothing worrisome from your doctor, especially towards abnormal cells or cancer, then it is still okay to consider management options that allow you as a woman to retain your uterus. After talking about menopause, it's very important to talk about the period of transition. So we usually refer this to as the perimenopausal period. So this is the 2 to 5 years that a woman goes through before they officially transition to menopause, or the periods completely stop. Now, during this time, most women will complain that their periods are becoming irregular, or they are becoming heavier, or they are noticing that their periods are becoming irregular, heavier, and prolonged. So these are common symptoms of just perimenopausal bleeding. It's important to understand that fibroids tend to complicate this period, because what are some of the common symptoms most women will present with when they have fibroids? Again, heavy, prolonged periods. So again, during this time, because of the hormonal shifts that happen around perimenopausal, there's a slight rise in the hormones before the ultimate fall. It is not abnormal for women to report that the fibroids are suddenly feeling bigger, or their periods are suddenly becoming more heavier or more prolonged because of that combination. The fibroids on one hand and the perimenopausal change or transition on the other side. So these two can lead to a woman requiring, again, intervention in terms of their treatment for fibroids. And in some cases, we might even offer surgery to remove these fibroids if the symptoms are too many or affecting the quality of life, because we know it's another 2 to 5 years before the actual menopause sets in. So that's very important to know. Anytime we talk about medical conditions, we always ask ourselves, so how does lifestyle come into play? Again, the healthier you are in your younger years, the better the transition through perimenopausal and menopausal period. So that means your diet, the more antioxidants you're taking, the healthier food you're taking, the more active you are in terms of your lifestyle. That means physical activity, taking care of your weight management. I know that can be quite a challenge as we age. All of us as women, we tend to retain more, and we may need to be more cautious about diet and lifestyle to be able to attain those goals. So this is still important even during the menopausal symptom. Actually, for most women who go through menopause with full-blown symptoms, here we're talking about outside the period symptoms, we're talking about hot flashes, we're talking about, so it can be head to toe. You'll notice women are balding because of the drop in estrogen. Their hair is becoming thinner and weaker. You may notice the skin is not as smooth and as healthy as it looked before or during the premenopausal symptom. Again, when it comes to the periods with the changes in the menstrual cycle, we've talked about that. In terms of weight management, it becomes a little bit harder. Again, because with the estrogen drop, energy levels are lower, so a woman might struggle to push themselves to a healthier lifestyle. But this is a misnomer, because the healthier you are, the better control you have of the symptoms naturally, and of course, there might be a need for treatment, what we call menopausal therapy in some cases.